NBC2 News Today.
Welcome back. This morning we are joined by Dr. Caroline Cedarquist, who practices preventative medicine and weight management in Naples. Today she has reviewed some studies which show we're not doing as well as we should when it comes to eating fruits and veggies. Now, I'm a fruit and veggie-aholic. I am, but I guess I'm in the minority.
Yes, you are, unfortunately. What a recent study done by the CDC showed that only 25% of Americans were actually getting the recommended 3 servings of vegetables a day, and only 1/3 were getting the recommended 2 servings of fruits a day. What's also interesting is another study in the Journal of Preventive Health showed almost the exact same numbers. And a little bit more frightening is only 11% of Americans are meeting both recommendations of the 3 vegetables and the 2 fruits.
Now, I know that it used to be 5 a day. That was what experts recommended. Is that the same? Has that changed?
That actually has changed. In 2005, the recommendation changed to increase the servings of fruits and vegetables. What's now recommended is to change it to cups to make it a little bit easier for people. And it's supposed to be 4.5 cups of vegetables and 2.5 cups of fruit every single day. So it indeed is more. The reason that the servings were increased is because there is much data that has shown that people who have a high intake of fruits and vegetables in their diet have much lower risks of certain diseases. And these diseases include high blood pressure, high cholesterol, heart disease, stroke, and even certain types of cancers.
Now, I know it's tough for children. Children are quick to pass on the lima beans and the spinach, but adults, many adults are the same. Why is that?
Well, what I find when I interview my patients and I ask them about their diets, I might sometimes find that their diets are very low in fruits and vegetables, and I'll ask, do you specifically dislike fruits and vegetables? And usually it's not the case. Most people will end up saying, I like them, but I don't take the time to prepare them. It really comes down to more meal preparation. So they're kind of deciding what they're going to eat sort of right at the minute that they're hungry, or they're just going out to eat, or maybe going to fast foods where choices with healthy fruits and vegetables are not as available.
I won't tell you about my 3-hour Moroccan couscous I made the other day. We'll talk about that after the show. But I'm sure you do have some tips on a quicker version of some fruits and veggies for us.
Yes, you know, what I really think is it all just comes down to meal preparation. And I think very important to understand is that eating right and eating healthy does take some time. And a lot of times it's actually people's last priority, but it shouldn't be. It maybe shouldn't be the first of the day, but just realize that they need to put a little time into it. What we try to do in our family is try to have lunch and dinner with 1 fruit and 1 vegetable at each meal. So we're already good about getting 4 servings in right there. And then usually throwing another in at breakfast for a fruit, and then some carrots or something in the afternoon is not so difficult, so you can meet some of the requirements. I find that making it a priority and cutting up the fruits and vegetables is key, especially with children. You'll ask them, do you want some fruits? They'll say no. If you give them a cut up apple, they'll eat the whole thing. And the same goes for adults.
And what is your favorite fruit and vegetable for folks?
Well, you know, I have no favorites for people, whatever works for them. But in my family, things that don't go bad easily are apples, grapes right now, whatever's in season. We've certainly learned that although strawberries are great, they don't keep very well, so we don't pack them in the lunches. And the easiest vegetable is, of course, carrots, the baby carrots already cut up, because there's no meal prep, just washing them.
And you can dip them in ranch dressing or peanut butter, so there's lots of options. Well, thank you so much. Her office is
866-401-3438 or go to www.bistromd.com.